Hello everyone, thank you for joining us today on the program Healthy Living. I'm Adisu Walsawakie. Tomorrow, being the 7th day in the month of May 2024, is a special day, is a day set aside to create awareness on asthma. What do you know about asthma? How can you get it? Are people usually born with it? Is this something you acquire when you're old? Is it something you contract, or, all of that? And what are the signs and symptoms? At what point should you go to the hospital? These and many more we're going to be looking at today in commemoration of tomorrow's event. So let's start today here, so that you will be abreast of the things you should know. A lot of persons get sick and don't know what they are suffering from. And the next thing is you're running from pillar to post, or running from one agbo to the other, or just doing self-medication. I heard today from somebody very reliable that self-medication kills, and it kills faster than you think. All right, so today let's look at the things you should know about asthma. So I have two beautiful people in the studio, and we're going to be talking about what this asthma is all about. So I will be introducing the gentleman first, so that he does not think that women, they have started, So let's introduce him. Join me as I make welcome Dr. Godfrey Inodiana. He's a consultant physician and pulmonologist. He's going to be telling us what that means. And seated beside Dr. Godfrey is Dr. Ibifiri Omwari. She is a senior registrar at the respiratory unit of the University of Benin Teaching Hospital. They are both from UBTH. Dr. Godfrey, it's been a while.
Thank you. So that's how life is.
Abi?
Very busy.
Okay, Dr. Ibifiri, happy to have you join me today.
Thank you, ma'am.
And you look very gorgeous. I can't say that about Dr. Godfrey. So let's look at what this asthma is all about. Dr. Godfrey,
Well,
what is asthma?
Thank you for having us, and thank you for this opportunity for us to educate our viewers on the World Asthma Day.
Okay, that's tomorrow.
Before we define asthma, it's good for us to understand that on the 7th of every year, the World Health Organization set out a day for people to understand the disease called asthma. So tomorrow will not be a different one. This year we have decided to look at asthma asthma education empowers.
Okay, so that's the theme.
So that's the theme for this year. And if you look at that theme, asthma education, somebody say that knowledge is power.
Is power. So
it's important for us to have some understanding of the disease called asthma. And every year, the World Health has set out this day for us to commemorate that day. That's why we are here.
Okay.
Now, talking about asthma, what is asthma? Just like every other disease, this is a respiratory disease. That's the first thing we need to understand. It affects the airway, what we call chronic inflammatory airway disease. So it comes from the airway showing a reaction towards various stimuli in our environment, subsequently leading to obstruction. So these persons that have asthma will find it difficult to breathe because they are having an obstructive airway. So asthma is actually one of the leading causes of death in our environment today. And it's important that everyone who have not heard, or those who are still denying the fact that asthma kids, they should understand that asthma can be managed. It is not actually a curable disease, but you can manage it. So that's why we are here today.
Okay, thank you so much. Dr. Ibifiri, what are the signs and symptoms? What are the things we should look out for?
Okay, so for asthma now, based on what he has described as the definition, it now comes with the symptoms of chest tightness, difficulty in breathing, and in some situations, cough, which does not abate even with the use of antibiotics.
Cough that does not abate.
Yeah, so chronic cough, there can be chest tightness, difficulty in breathing, with wheezing. So those are the major symptoms to look out for in a patient with asthma.
Okay.
And with that, you want to, of course, the difficulty in breathing is one that makes the patient so uncomfortable. And that's their usual complaint when they come to the hospital. Oh, most times early in the morning, or if I exercise, or if I just eat some certain things, or perceive some certain things, I start to have this sudden onset chest tightness, which is the commonest complaint we get.
Okay. So,
both
Dr.
adults and
Nodiana, how do
children.
people get it? How is it contracted? Is it something one is born with?
Yes, that's why it's important for us to really understand this asthma as a disease. We in the respiratory medicine will tell you that asthma is both what we call genetic and environmental.
Okay.
Now, some persons will have asthma, others will not. So it means that if one is not having a tendency to get it from the genes, as in from parents, father, mother, siblings, if they are not having it, then what about the environmental factor? So asthma comes from these two broad divisions, genetic and environmental. So it means that when one had the gene to develop asthma, then when the person is growing, maybe from between 0 to 12, the asthmatic symptoms will start. Or those that are also adults can also have what we call adult-induced asthma. Then environmental factor too can also lead to asthmatic symptoms. Those exposed to the polluted environment, those exposed to smoking and other pollens in our environment, they can also develop asthma. So these are the two ways, broad ways, which asthma can result in a person.
You know, it's somehow very confusing why an adult should develop asthma, because I remember vividly when I went to see somebody, the first questions I was asked is, are you asthmatic? You know, and the person does not have, I've never had an issue with asthma. So that got me thinking that so adults can actually get this thing. So let's look at the adults getting asthma as a result of activities in the environment. What should an adult avoid, apart from smoking?
Okay, like we have said, the asthma can be adult, can even be adult onset. So that means in majority of cases, children will have asthmatic symptoms when they're young and start taking medication. But some persons will just grow up, they've never had these symptoms. That will be the first time of presenting to the doctor.
To the doctor.
And once the doctor examines, will say it's asthmatic, and they will begin to ask themselves, how come? Why should I have asthma at this my age? That's why we also have what we call adult onset asthma, because it was never there from when they were growing up. Now, having accepted that this is the disease that you can actually not cure but manage.
It's not curable.
It's not curable, but it's manageable. So it means that once the patient presents to the hospital, the doctor will now examine and tell you, oh, this asthma, these are what you need to do. What we call triggers. Asthma has a lot of triggers, things that can make asthmatic that were once dormant to become activated. So once, for example, a perfume, somebody may not be using perfume all the while, and the person will just travel somewhere and get exposed to another person with a very strong perfume, or some other allergens that the person has not been exposed to. As soon as the person come across these allergens and this perfume or other triggers, cold air can even just travel from a place to place with be inside the car, and the car is so cold before you start having asthmatic symptoms. So once this patient accepts the diagnosis and now is now looking for a preventive measures, these triggers will now be listed for this patient. Avoid this, avoid that, avoid it. By the time you avoid all these various triggers and triggers I've mentioned, then you are going to do very well and be on the right medications.
Okay, Dr. Bifiri, now let's look at children. You know, like when children are born, luckily for some in teaching hospitals, things like this are easily detected. All about those that are born in birth homes, where you have this traditional attendants, all of those persons, these things are not usually detected on time. And then, so what are the signs that mother should look at for in that little baby? Because a lot of mothers are often the time very careless, so to speak. There are some things we don't notice, particularly because there's one grandmother, one grandfather, one neighbor, one person there that knows everything. Say, put on your, put up for the side like this, put on your, put ude, ude is palm kernel oil, the black one, then of course we don't share butter, just put it like that, use breeder blade, tear it like that, that kind of a thing. So how can such a parent who does not know or who does not have this kind of knowledge know that this child is suffering from an ailment?
Okay, so in children, first of all, depending on the age, for children that cannot talk, cannot express themselves, it has to do with the observation of the symptoms. Now, a lot of times there are some, in the first few months of life, there are some illnesses that actually mimic asthma. You have even bronchiolitis, infection in the chest. you can have pneumonia. Now, all these things come with similar symptoms. The only difference may be that, okay, there's fever, on investigation, there's evidence of infection.
Okay.
Now, for asthma, it's basically for the parent to look out for how well the child is breathing.
Okay.
Now, there's some children that struggle with
to breathe.
Yes, they struggle with breathing. So, especially with the wheezing sound, it's not one to ignore and say, okay,
yeah,
it's
like
just
what kind
cold.
of sound can you
like
just...
with whistling sound.
Okay, like that. Okay.
That's what it usually sounds
I
like.
wanted you to demonstrate so that mommy out there would understand
so
what
it's
we're saying.
It's a whistling sound, like, so you beside the child will be hearing that
sound.
Yes.
So it's not normal.
It's not normal at all while the child is breathing. And so now for some children, as they now grow, maybe from like 2 to 3 years to 4 years, you notice that the child has continuous kata. Maybe child will go into a place and just start sneezing. Itching scratching the eyes at intervals. All these things just show that child is allergic or may have symptoms suggestive of allergy. Yes, we call them atopic symptoms. So that's why...
You call them what?
Atopy.
Okay, atopic symptoms.
Atopic symptoms, yes.
Okay.
So that's why, just like you were asking about some adults, that some adults may not have had that typical difficulty in breathing till they get to certain ages. But by the time you now take further history, they tell you, oh, since I was a child, I always have this sneezing, I always have kata. In fact, round 247, round the clock, I'm always having kata. All those things show that the patient may be allergic, and these are like the building blocks of patients with, so you know that patient is at risk of coming down with asthma. Like he's talked about genetics. People that have those genetic predispositions are those that end up coming down with asthma. So in children, you must look out for those signs. Difficulty in breathing. For some children, and you know, children like to play a lot.
Sure.
There are some children that cannot even attempt running. They just start to have this difficulty in breathing. There are some that cough and cough and cough and cough, this dry cough that is not going. And then the parent may have bought over-the-counter medications over and over again.
Squeeze bitter leaves.
Exactly. A whole lot rub, just like you said, Oreo on the chest wall, because it said, okay, no, this child just has a cold. No. In such a child, you want to now go further to investigate and then treat appropriately. So basically, a physician, a doctor should attend to that child.
Not a chemist.
No. Because they'll end up treating the cough over and over and over again. And then we've moved away from, in fact, we don't treat asthma with oral medications.
Okay.
Although there are some newer advanced medications that are coming into play. However, the commonest things we see a lot around are the fact that people use tablets, or Ventolin tablets. All those things are things that we do not advise. So that's why the child should be brought to a specialist so that the child can get that better care.
All right, Dr. Nodiana, from what I have seen and experiencing in movies, seen on TV, watch on social media and all of that, you know, patients usually struggle. You know, something could just trigger that person. And you see the adults holding the chest, you know, struggling to breathe, and the next thing, he or she is on the floor or on the ground, depending on where he or she finds him or herself, and the next thing is, don't go. You know, why do they have to? Is it that they don't have this sign that this thing is coming? You know, like somebody who is epileptic will always have that sign that, oh, seizure is coming, or is it that they don't usually have that sign that, oh, this is coming?
They do. Sometimes it's, you know, asthma, like we said from the beginning, is an airway disease. Airway in the sense that there is a secretion of fluid. So once you have a pipe where fluid are now being secreted, so it becomes narrow. And once it becomes narrow, it means the air that's supposed to pass, the volume, is not going to pass again.
It's not going to pass.
And you need that air to exist. And because the man is trying to now still breathe in well, then that tightness is already there. So the man will start struggling. So it is that narrowness of that air that leads to that sound that you are hearing, the wheezing sound. You know, you hear the wheezing sound. So many times they do have that like an information that this thing will soon happen. But the question is, do they accept the diagnosis? Do they accept to quickly go to the hospital or tell anyone close to them? Because most of the time, when you go to the teaching hospital, the emergency room, The asthmatic cases that come what we call acute severe asthma. Sometimes it's life-threatening because in our asthma we have the way we divided it: severe, moderate, mild. Depending on the symptoms and depending on the things you are going to record when you are examining this patient. So before these symptoms become so bad, yes, they have the feeling that they are going to have. That's why the medications we use, we have what we call the preventer and the controller. So a particular drug is given to them if they really come to the hospital, that at any point in time, somebody walked, an asthmatic, you walk into a crowd, a dusty environment, you walk into a place that they have already told you about the triggers, and you are sensing that you are not breathing well. It may not just happen within 5 to 10 minutes. You will have a feeling that I'm not breathing in well. The next thing you should do, tell your neighbor. That's why one of the inhalers that they normally use, you tell them take it along even to the toilet.
Is it so heavy that they cannot carry it along? Because most of them, you see them with that inhaler during crisis time.
It's acceptance. It's acceptance that, oh, this inhaler in my hand, it must follow me to anywhere I'm going. By the time the person has an inhaler, maybe in a crowded environment, decide to withdraw himself or herself to somewhere and just take the inhaler. The patient may not come to the hospital. Or many a times they will leave the inhaler at home, or they don't even believe that they should take the inhaler along. And their neighbor, maybe their friends, colleagues may not even be aware that, oh, this person. Some people see asthma as a communicable disease.
Okay, it's not communicable.
So you shouldn't, that the neighbor has an asthma does not mean you will have it.
So I can share a cup, plates, utensils with an asthmatic patient.
So a lot of persons think, oh, asthma is a communicable disease, so let me not tell people that I'm asthmatic. First education is to tell people that, look, I'm asthmatic, so that they will tell you, where's your inhaler, keep it in a safe, clean, visible place. So that once you have this symptom, everyone at home should know where the inhaler is. So that as soon as he or she is now having that symptom, before it becomes so bad, somebody should be able to go to somewhere, pick it, and give it to her or give it to me. But like I said, we have a lot. We use faith for so many things.
It's a God forbid thing for some
persons.
persons.
We use faith for so many things, and it's not my portion. And once it becomes the person's portion, he or she may not be able to pray.
To accept
people around will take the person to the hospital, and we even pray to take the person to the hospital. But if not hospital, another person may even begin to administer deliverance to that patient, not knowing that this is just an severe asthma, an asthmatic attack that is in progress. All they needed to do is to see a doctor who will now administer the right medications to relieve the airway. Because in asthma, the airway is actually closing.
It's closing.
And once the person's airway is closing, air cannot go in, there is tendency to die. That's what we do. So what the doctor will try to do is to give medications that will open the airway, so that this same person, in fact, you see where an asthmatic patient is treated, within 20 minutes, somebody that is almost dying within by 3 o'clock, by 3:30, somebody talking.
The person is already
because
talking.
what happened was that the airway was closing, the doctor opened the airway using those medications. What we are saying today, you get the medication at home, or take your medication so that you
carry it about. Anything can trigger.
Yes, this education
your crisis.
Admitted for asthmatic treatment. Just follow up treatment. You see your doctor regularly, accept the diagnosis, and all will be well.
Okay, Dr. Bifiri, let's address the issue of stigma. Because a lot of persons don't want you to know that they are asthmatic. They see it as a very shameful thing, and the way people will react to them. So perhaps that is why many of them don't go about with the inhalers. You know, they keep it somewhere until the crisis set in. And when that happens, you're looking for inhaler, you're running from pillar to post looking for it. So let's address the issue of stigmatization. How do you talk to a patient who is asthmatic, and then the neighbor who gets to know and start to mock that person?
Okay, so first of all, it's about acceptance. A lot of patients, like you said, don't want to accept their asthmatic.
Because it's not our portion.
In fact, the moment you talk about the use of inhalers, the person is already, some people go ahead to ask, is it forever? Will I use this forever? Is this how my life will be? But the truth of the matter is, with consistent use, for example, the controller therapy, they are the daily medications, just like the BP drugs, taken daily. Now, and that's what we call the maintenance.
Yes.
In fact, we've gone past that level. Right now, we're even talking about various stages.
Okay.
So it depends on the stage you are. You may just need the medication when necessary, and then before it gets to that level of consistent treatment. So the first thing is acceptance. So I always encourage patients that it's about being alive to be able to live, and not necessarily listening to others around.
To what other people are saying.
I had a young patient she's in the university, and she kept complaining, oh, my roommate is always opening up the windows. She knows I'm asthmatic, but yet she doesn't bother. She's always walking. And I told her, the best you can do for yourself is to change your room.
Relocate if you can.
Relocate, because your life is more important than every anything around you that wants to cause a stigmatize. So the thing is, the basic thing is about accepting the diagnosis and knowing that with proper care, you will do well. You will not even be embarrassed on the way. It's just like people who have seizures. If you take your medications well, you will hardly have to be embarrassed. People may not even get to know. So that's how asthma works too. If you use your medications well, you may not necessarily have to use those reliever therapies frequently.
All right, Dr. Nodiana, in say 10 seconds, can you just, give us your word of advice?
Okay, if the World Health decided to choose Asthma Empower Asthma Empower Education, or Education Empower, it means that if you are asthmatic, accept it, come to the hospital, take your regular medications, don't live with faith is not for illnesses. Once one is already ill, you need to see a doctor who will tell you what to do. Asthma is not curable, but is managed. And asthma is not a death sentence. So for everyone that can't breathe well, morning or night, see a doctor who will make an appropriate diagnosis, and good therapy will be given to the person.
All right, doctors, thank you very much for finding time to be with me on the program, Healthy Living. I'm hoping that Thursday we'll do Pidgin English version on radio.
Okay, so just to add, I would like to thank medical. I'm also representing the medical.
You are not representing them. You are here to. I know you are a member of M1. You are here to talk to Adesu Wasawagie on ITV. Thank you, Dr. Ebifiri, for finding time to be with us. All right, people, this is it. Asthma is not curable, but it is manageable. Manageable only if you do not indulge in self-medication. All right, see a doctor first before you take any medication at all, okay? You are not a doctor. And what my PD knows about drugs, I may not know it, okay? And don't listen to anybody other than a medical doctor. We'll see you again next week. Bye-bye.